a lot of people do not know the proper or the correct way of breathing. So when I ask someone, please take a couple of breaths, and I look at their belly, I see that in fact, when they're breathing in, their belly is going in. And then when they're breathing out, their belly is coming out. That's the reverse of what is the correct way of breathing. When you inhale or breathe in, your diaphragm expands. So your belly should come out. When you exhale, you're contracting your lungs and diaphragm. So your belly and your chest has to go in. So the first step is to teach people the correct and proper way of breathing. Of course, first it starts with understanding the mechanics of the breath. So when I do that, I ask people to use their hands to support and understand the movement of the chest and the belly. So my left hand is on my abdomen right now, on the navel center, and the right hand is on the chest. And I simply ask, and we could do it now, that as you inhale, notice a rise in your diaphragm, basically your abdomen, and then somewhat the chest. And then as you exhale, notice that the belly goes in, it sinks in, and so does a little bit in the chest. So then inhale, exhale. And sometimes for me to guide their breath, so because when you ask people to breathe in and out, you notice that it's so short and quick. So then I add counting of numbers to it. So I may say, I'll count to 4 as you inhale to the count of 4. Then you exhale to the count of 6. So then with the hands on the chest and the belly, inhale to a count of 4. 1, 2, 3, 4. Exhale. 1, 2, 3, 4, 5, 6. Inhale. 1, 2, 3, 4. Exhale. 1, 2, 3, 4, 5, 6. And then sometimes I add a pause, because there is a natural pause between inhalation and exhalation and vice versa. And so I may count to 4 as they inhale, then hold for a count of 2, then count to 6 as they exhale and hold for a count of 2. So we could do that. Inhale, 1, 2, 3, 4, hold, 1, 2, exhale, 1, 2, 3, 4, 5, 6, hold, 1, 2. Inhale, 1, 2, 3, 4, hold, 1, 2. Exhale, 1, 2, 3, 4, 5, 6, hold for a count of 2. So this basic form of breathing is basically bringing connection to the breath, especially because you're also tactile sensation with the chest. You're connecting even more physically to the breath. You feel the sensations of the breathing as your belly expands when you inhale, and it contracts as you exhale. So now this is the beginning of learning how to breathe correctly. Then we will bring that awareness throughout the day. So I would say throughout the day, maybe when you get anxious, bring your attention back to your breath. When you're stressed out, bring your attention back to your breath and do the abdominal or the diaphragmatic breathing. Pay attention to your breath. Do that throughout the day. If someone doesn't really, know how to in tune themselves when they're stressed or anxious or they forget, I'll ask them to set a signal or an alarm on their phone, something that is soothing actually, multiple times a day, like let's say every 3 hours. And in those time segments, bring your attention back to your breath. Breathe with the belly, abdomen. And when you exhale, make sure you're abdomen contracts. Sometimes that's so difficult for people. Like they say, I don't know how to contract my belly when I exhale. So then in that case, you have to tell them to guide the movement with the hand. So a little bit of pressure on your belly to actually mechanically push the belly in as you exhale. Now, when you inhale, you'll see naturally your belly expands because the air has to go in. And so there are many different tricks and techniques of making sure someone is breathing normally, and that brings their attention back to the breath throughout the day. Because it's not just about, okay, once or twice a day I sit and meditate. That is great, but it's also to learn, even as you're engaging in your activities of daily living, that you keep bringing your attention back to your breath. You're conscious of your breath throughout the day.